Someone comes in for facial cosmetic surgery, I often say to them, it's like looking at a very beautiful, older ranchette. And the ranchette can have surface problems or it could have structural problems. It could be leaning a little bit, needs a facelift, or it can look good from a distance, but when you get close, it looks a little bit rough. Laser resurfacing, chemical peel, that kind of thing. And sometimes it overlaps, and we just have to decide what's going to be the biggest bang for the buck, both in terms of time budget, money budget, and what you'd like to have done. So, if it's coarse or fine, delicate wrinkles, if it's brown spots, if it's red spots, rough skin, I use laser resurfacing. So we use our fractionated Ultra Pulse Encore Luminous laser. That's a mouthful, I know, but it's a fractionated laser, heals very quick, 7 days, sometimes 5 days, depending upon which technique we use, and really cleans up and tightens the skin. You get some mini facelift effects out of it. Sometimes I'll use it in combination with a facelift. Sometimes we do a facelift only, and this is to lift up the cheek for folds here, or for jowls, or even for a loose neck. This facelift, the one we're doing most often these days, is called a max facelift, M-A-C-S. It has a name associated with it, but many times my patients are out in public literally 3 to 4 days later. Some people call it a lifestyle lift, and a lifestyle lift is really just a copyrighted name and a marketing firm that used that name. It's taken from the max facelift. A max facelift has a incision in and around the ear. It's very irregular, so it's not very noticeable. These days, we don't make the incision behind the ear go way into the hairline. We use what's called a short scar technique. So typically, you're going to have to hide that scar until it matures for a few months. But we can lift the face with internal sutures once we have the skin elevated a little bit. We don't elevate the skin all the way like we used to. The internal sutures lift the malar area, the jowl area, and the neck area, and we can really lift up the face pretty nicely. The other thing I've been doing lately is using Tisseel, T-I-S-S-E-E-L. It's a fibrin or tissue glue. And at the end of the procedure, I put this glue in there. It's a biologic agent, and it seals the skin shut. We have very little bruising, usually, and literally 3 days later, my patients are out in public, and the results have been phenomenal.